Great. Thank you, Kate. Okay, so welcome again. We're really excited today to have a Caregiver Centered Care presentation by Jasneet Parmar and Sharon Anderson, who are joining us to share their work. And after the presentation, we'll have a couple of resources to share with you and talk a little bit about our next meeting in January. So I will stop sharing and hand over the screen sharing to Sharon, who will walk us through their presentation.
All right. I think we're good. I'm going to start and Jasneet's going to take over from me about halfway through. And so just want to talk a little bit about why we use these blobs in our presentations. It's the space between us. While person-centered care, we talk about supporting family caregivers, but there's often that space between providers and family caregivers. And our goal in our caregiver-centered care education is to close that space. All right, so we're going to talk about why support family caregivers, what supports are needed, and how we can work together. And I'm sure that everybody has heard lots about Rosalind Carter, but she was just a real advocate for caregivers. And this is probably one of her most famous quotes about caregivers. There's only 4 kinds of people in the world: those who have been caregivers, those that are caregivers, and those who will be caregivers, and those who will need caregivers. So family caregivers are the invisible workforce. 1 in 4 Canadians are family caregivers. And as Rosalind Carter says, that'll eventually be 1 in 2. And family caregivers are assets to the healthcare system and to communities. They support the social connections, dignity, and well-being of of the people they care for. They provide 90% of the care to community dwelling Canadians, and assist with 15 to 30% of the care in long-term care. And actually, I've just found a study, it's actually greater than that. And so it's closer to 50% of the care in long-term care, according to this American article. It may not be that high in Canada, but it's close to 50% in the US. That care, that 97.1 to 112 billion yearly, is worth 32% of Canada's health spending. That's the entire spending on healthcare, every province, all that spending. And actually, the 12 billion that Alberta family caregivers contribute is actually a third of the 2021 entire Alberta health budget. So definitely definitely an important part of the care system. Now, I want to talk about Grant Bruno. Grant Bruno is a PhD candidate. This is him and his family. He has 2 children with autism. He's from the Sampson Cree Nation, and he's about to get a PhD, and he's been offered a position in family medicine. But he talked about care gifting. Caregiving is a gift to the people they care for, to the family, the community, and society. And this particular article talks about people needing assistance, receive support and care, have better health and well-being, and it can help them stay engaged in work, volunteer, and family roles as long as possible. So that's that family caregiver role that helps to do that. Caregiving can reduce the need for paid services from health and social care services and transit systems. Continued care from family and friends may enable people who need care to remain at home or delay moving to congregate care. So aspirationally, we need caregiver-friendly communities. And we need to really apply, as you know, with dementia-friendly communities or age-friendly communities, you need to apply a broad systems approach to caregiving And it entails a vision to caregiving and community, which all caregivers have the training and knowledge to provide needed care. Health and community care providers always involve caregivers on their care team and refer to them to supports and services to help maintain the caregiver's own health. And that requires provider training. And this Centers for Disease Control article actually makes that point quite clearly. Employers should institute supportive policies and practices to accommodate all caregivers' needs, and all caregivers and people they care for readily participate in community life and find support wherever they live, work, and play. And certainly that's your mission as well. So really want to point out that young caregivers also need our support. This particular study is one of young caregivers age 5 to 25 years. And according to this particular study, Canadian young caregivers spend between 14 to 27 hours per week caring. That's equivalent to a part-time job. And they may also have a part-time job on top of that. So very significant savings to the healthcare system and society. And this is what one provider said: balancing school, a lot of the youth that I supported were full-time caregivers, going to school full-time, and often we're also working part-time or full-time at the same time. So one of the things that would benefit young caregivers was online access to school, and that came with more flexibility. So this was during the pandemic is when this study was done. We know that caregivers have lots of challenges to manage. They manage the care, medication and medical appointments, and also that a lot of that medical care is now being downloaded to family caregivers. Family caregivers are often doing tasks that only licensed health nurses and doctors used to provide, and still need to be licensed to provide those services in hospital, but caregivers are also doing them at home. There's an emotional and physical burden. Being on call all the time and being interrupted as you're doing things is also a significant challenge. There's out-of-pocket costs. It can be up to $7,000 in out-of-pocket costs. There's also the structural burden of care. That's assuming the roles of project manager and the care coordinator, and then setting aside one's own needs is also an issue here. And I want to just play this video because Linda Powell.
Our caregiving journey started in 2011 with the onset of a very difficult medical situation with my partner, my husband, and an unexpected journey ahead for the next many, many years. My background has been physiotherapy. My original training was physiotherapy, so certainly familiar with medical background. And then over the past 25 years leading up to his illness, I worked with Stars Air Ambulance. So very familiar with the challenges of an illness or medical situation, but certainly did not anticipate what we would be going through with a life-threatening illness in our family. I also have been involved in caring for an elderly family member as well, with another family member. And certainly that caregiving situation and dynamic brings on different challenges with different circumstances. The positives of caregiving are enormous. You become closer to your loved one in many ways, in ways that you never expected. It's a helping and caring situation. It provides an opportunity to give an example to the younger generation on the challenges that they'll have in the future, and set that example. It breeds resourcefulness. Certainly my background and that of other family members helped us pull in those resources, but the resources aren't always there. And sometimes you find yourself very alone. So from a positive perspective, that forces each of us to ask for help, which is very hard to do. I think a lot of us just want to cope on our own. We can manage this. I can handle this. And that's not always the case. Caregivers need to learn to say no. I know I tried to take it on myself and say, I'll handle this. And it's physically impossible to do that. It's isolating. Caregiving is isolating, especially as illness proceeds. And we certainly had the situation where at one point I wasn't really able to leave the house unless I had relief. And that's very difficult. Once family members have exhausted their vacation and their days off and can't lean on friends forever, they have their own lives. How do you find resources? So caregiving tightens your circle. Caregiving puts you in the situation of coming face to face with the fear of loss. And that was certainly our case, is trying to do everything possible to ensure that the best care possible and the best solutions were available. And that was the backdrop to all of this, is trying to make sure that survival was the end result. The other negative is financial. We found ourselves very quickly in a situation where we needed to retire, which was the plan in any event, but certainly expedited. And that puts a different dimension when you're doing your last sort of 5 years of work and realize that it's not going to be there.
So what do people say about our education? I did not realize the number of providers that it would take if there were no family caregivers. The healthcare system is so strained, and that's pouring out into the general public, and there needs to be a better way to support family caregivers. Excellent education. Believe that the healthcare team often puts family caregivers on the sidelines. After finishing this module, I realized how much input they can provide us with the quality of the care recipient. And what you notice is rising family caregiver distress. So anxiety is the most frequently occurring disorder in caregiving. It typically rises as care responsibilities increase and energy is depleted. And anxiety really increases the risk of premature heart disease, dementia, and premature mortality. Caregiving is a social determinant of health in Britain and in the US. So where's that stress and anxiety distress? In 2010, in home care populations in Canada, it was about 16%. By 2016, it had risen again in home care populations. Those are people that are providing intensive care, 33%. And in our 2022 study of family caregivers, it was actually 54%. And that's an average. Those caregivers that are caring intensively will be much more distressed. So I really want to point out that you need person-centered care for family caregivers. There's not a one-size-fits-all solution to meet a caregiver's needs. Caregivers are very diverse: age, gender, culture, ethnicity, employment, socioeconomic status, and health. And then look at the differences in the care receivers that they care for. That also makes that caregiver situation diverse. Their relationship, illness, the cognitive status, the strengths and skills and needs of the person they're caring for. And then go into the caregiving characteristics, the trajectory. You know, it used to be that caregiver trajectories were about 4 years on average. It's much closer to 6 years now. The skills and experience that the caregiver has and their network and their family obligations make a huge difference, as you heard Linda Powell say. And again, the caregiving context, that living situation, whether new is a good one to talk about the difference between urban and rural, the proximity to family and resources. And let's face it, community friendliness is also a big one. So caregivers need person-centered care. And I'm going to turn it over here to Jasneet.
Thank you, Sharon. So the question then we are faced with is, what do we do going forward, keeping in mind all the statistics that and the evidence that Sharon has shared with us? Where we are going, hopefully, and where we need to go is an integrated system to support family caregivers. As Sharon said, no one organization, no one discipline, no one setting is enough to support family caregivers. All of us have to be involved. Regardless of where we are situated, we will be interacting with family caregivers. This could happen in the healthcare system. For sure, we interact with family caregivers across all our settings, but so do we in the community. Regardless of where you're in the community organizations, community-based initiatives like yours, the mandates of these initiatives all require family caregivers to be present. Society depends on family caregivers. And wherever the society is present, if you think about it, it could be in schools, it could be in libraries, it could be in transit, it could be in the various lives of working caregivers, which is employers. There are caregivers present, and we all need to recognize them. It's time that family caregivers are recognized across the spectrum. What more do we need? Well, we need to support them. And how do we do that? We've got to look at all the community, social, healthcare systems, government. All of us have to develop partnerships, integrate around where family caregivers need us the most. We need to create these robust systems where each of us, wherever we exist, health or community-based care, in the government, in the society, wherever we exist, we are looking at whatever system is present to shine the light on family caregivers. Having recognized them, look to see how we can support them. One major system that has to come into play is education. We've got to educate, supporting family caregivers into training of all providers, whether they be based in the healthcare system or in the community. And finally, yes, we do need policies. We are looking for a legislative act to support family caregivers, but definitely policies. And each one of us, it behoves us that as we carry out a variety of initiatives, we examine the policies under which those initiatives are being executed to see what are they saying about supporting family caregivers. Next slide. So one of the things we learned in our 10-year journey on examining how to support family caregivers is there's a big gap in education. This is education of health and community care providers. We have received very little training, whether it be knowledge or skills or approaches. Most of what we learn is organically through osmosis. Some of us do it well, some of us don't. And we often don't engage with family caregivers because of lack of confidence. We don't have the comfort. We don't have the knowledge. So we are left with this uncertainty amongst our health and community care providers as to how to assist and support family caregivers. Next slide, Sharon. We are calling caregiver-centered care the person-centered care for family caregivers. It's not enough to provide patient and family-centered care. of person and family-centered care. It has to go beyond that. We have to also provide for caregiver-centered care. So our language has to change to patient and caregiver-centered care. It has to change to person and family caregiver-centered care. And what do we mean by it? Caregiver-centered care is a collaborative working relationship between family caregivers and the health and community care providers to provide this person-centered care to family caregivers, to support them in their caregiving roles, because we do need them to sustain care. Also, help them with supports and services, care management, and advocacy. It highlights that caregivers play a crucial role in overall care and well-being of the people they care for. We need to recognize their importance, ensure that they are seen as vital collaborators alongside us, health and social care professionals or community care providers, not just people that we download or shift work onto. So with that in mind, during our journey, this 10-year journey that we mentioned, caregiver-centered care was born, and as was the caregiver-centered care competencies, and then the education. The caregiver-centered care competencies are really important to be mindful of. And this is all evidence-based. This is all the research that, and how do I say this? This is not Sharon and I. It's over 400 stakeholders, 66 organizations that came together from 2014 to 2019 that helped us develop and design this caregiver-centered care competency framework. And then since 2019, we've had close to 150 members on our co-design team that have helped us develop the education. It belongs to all of us. It's out for public good. It's evidence-based. It's held the test of time. And it consists of, and I'm sure this will resonate with you, recognizing the caregiver role, communicating with them in a timely fashion, partnering with them. Fostering resilience is about assessing their needs and then supporting them in navigating the health and social care systems and accessing resources. And one competency that also emerged and got a lot of importance was enhancing the culture and context of care. And this is the plea to everyone that is engaged with family caregivers is look at your culture, look at that context, and look to see if our culture is one of acknowledgement, respect, and support. Next slide, Sharon. The co-design has been doing with the stakeholders that are going to use this education. It has truly been a remarkable experience. The representation on the co-design team comes from across the spectrum of care: community, healthcare system, policymakers, managers, frontline staff. And you will see this co-design being reflected in the education that has been created. Next slide, Sharon. There are 3 levels, 2 that have already been put out for public good, foundation and advanced education. We also have another module that we created for COVID-19, which has also been very valuable. The foundation education is for all health, and now we've added social care providers who interact, or these social or communities, sorry, I use that term interchangeably, who interact with family caregivers. Advanced education is for those health and community-based providers who have more interactions with family caregivers, have significant responsibility, or is considered within their scopes of practice. We are now developing the caregiver-centered care champion education. We have 70 caregiver-centered care champions already recruited to give input and pilot the education. All of these are now being put out Some are already out for public good. Next slide, Sharon. And they're all available on this website. This is being now used across Canada. Please, it's free, it's online. All this education can be taken asynchronously on your own time. I would highly recommend just taste it. Go on to the various courses and get a feel of what they're about. Family caregivers are taking it so that it gives them the language they need, the expectations they can have from us. We've had close to 6,000 take the foundational, close to 3,000 take the COVID, and now with the advanced education, it has been evaluated and it's been released for public good already. We've had 900 people take the various levels within advanced education, and all of it has been evaluated very highly. Next slide, Sharon. Sharon's going to give us a taste of this education.
I care for patients all day, and then I go home and I care for mom at night. I don't see any of my friends. I'm feeling this course I need because I don't have enough time to study, and I'm stressed out all the time. I didn't think it would be this hard. I wouldn't wish this on anyone. I feel helpless. I'm worrying all the time. Is she eating properly? Is she staying inside the house?
Thank you, Sharon. So while we designed this course with healthcare providers in mind, what came to light was, if you think of this example, this person with dementia is living in the community. Her caregiver is a nursing student, so we get to interact with her in the healthcare system and we offer her support, but she's actually providing the care in the community. So the question then that is in front of us is, how do we support her? This person receiving care, the person living with dementia, of course, as and when she interacts or the caregiver interacts with the healthcare system, needs to have healthcare providers who understand the needs of both the care recipient and the caregiver and address them. But at the same time, those interactions may be few and far between. This dyad is living in the community. How are their needs going to be met in the community? And that's why we find that this education is being taken on by community care settings, by community organizations, because they are using it to train the care providers within their organizations to similarly look to see how you can support this dyad in the community with the resources that are available in the community, and also how to interact in a collaborative manner with providers in other settings such as healthcare. Here are some quotes from this Caregiver Centered Care education. I enjoyed the opportunity to practice my conversations with through this multimedia and getting to choose what I would say next. It's an interactive course. The videos where you choose verbal responses were really helpful in providing examples of language to use. And this is across the board. Everybody finds this language, acquiring language you can use when you're interacting with caregivers. The healthcare system will fail without family caregivers. Working as a team to meet the needs of the family caregiver, the system is creating a better care environment. Next slide, Sharon. So briefly, what we got to remind ourselves is education and training are recognized strategy to bolster evidence-based practices and to change the culture and context of care. We only know what we know. And it is so actually revealing to see the qualitative responses coming from these creating and studying this education. We have thousands of quotes where care providers across all settings have said how much it has helped them acquire the knowledge, the skills and approaches to interact with family caregivers. And thus, we need to keep moving in the caregiver-centered care education. We need to spread and scale it. Here are some more quotes. This was great. I did not know we had such a resourceful module for health and community care providers. Most relevant course I've taken so far this year. This education should be part of the curriculum in all professional roles. It is an amazing course. Thank you. I have recommended this resource to leaders across my health system as a terrific example of opportunities to support the realization of integrated people-centered health and community systems. Next slide, Sharon. This is just a shout out. It's just one example. We now have lots of examples across the various systems of care and across Canada, different provinces who have taken on the education. We call them leading adopters. So this is a call out. We all have to work together to have what we call this collective impact at the micro, meso, and macro levels. And we all need to get involved, whether it's the healthcare system, the researchers, government, the age-friendly communities, the community organizations, and the educators, to bring about the support that's needed for family caregivers so they can sustain care and also maintain their own health and well-being. Next slide, Sharon. Another quote, and this is from a family caregiver, and 25% of all participants in this 10-year journey have been family caregiver, besides almost half of the participants being double duty caregivers. So they are either health or community care providers and they're caregiving. I have gotten a lot of help that I'm grateful for. I do not believe that caregivers provide 90% of the care. I'm not a priest, medical doctor, psychologist, dentist, or psychiatrist. I provide as much care as possible to supplement what is available. Some days that may be 100%, other days I may be a spectator. And this quote is helpful to keep the diversity in mind, the trajectories. Sharon spoke about average of 6 years. There are caregivers who've been caregiving for 20, 30, 40 years. There are caregivers who provide caregiving to multiple people at the same time. They could be looking after children with disabilities, and they could be looking after aging parents, or they could be looking after their spouses or siblings with brain injury or addictions and mental health issues. They could be providing care full-time, 100% of the time. And there are other times when they may be, as Jim said, a spectator. This is an example of someone who has a spouse in long-term care and provides care, tremendous care, but other times just watches the others in that setting providing care to his spouse. So these roles are very variable, but what we need to remember is these caregivers are ever present. I'm going to finish off with a call to action slide, and I'm going to ask you, are you identifying family caregivers and including them in your planning? Does your asset mapping include who is available to support family caregivers? Are the providers who work with family caregivers in your initiatives taking education such as this caregiver-centered care education? Do they have the knowledge, skills, and the approaches that are needed? And are caregiver-centered care champions embedded in your team? Next slide. And at this point, I will share these two contacts with you. We are looking to have you join our co-design team. We're looking for you to spread and scale this work. Glenda Ternowski is also online. She is our growth and innovation lead. If any one of you wants to spread and scale this initiative in your setting, please contact her. You can contact Sharon and I as well if you want to join the co-design team or if you'd like to be a Caregiver Centered Care champion. Thank you.
Thank you, Sharon and Jasneet. That is, it's amazing to me when I hear your passion and commitment and to getting the information out for not only healthcare providers, and I think that's one of the beautiful things about the education is to acknowledge it's really that takes a village approach when you speak of the caregiver champions, etc. So wonderful presentation. We'll just take the opportunity here to open the floor to any questions or comments, thoughts maybe from people who have taken the caregiver education. And I did get bumped out of the meeting, so I've lost the chat when I came back in. So I'm not sure if there are questions in there to to address. So I'll rely on my teammates to flag to any of those. But we'll open the floor for any comments, questions for Sharon and Jasneet.
It's Jennifer. I just wanted to comment and just acknowledge Sharon and Jasneet for their amazing work. I have had the true pleasure of leading this program to a primary care network, and the feedback in the room is absolutely amazing. The teams just come together and bring up conversations that they wouldn't otherwise have the opportunity to do. So my experience in Calgary was that it was a huge team building experience, and that there were a bunch of folks who didn't even know within their own organization who was providing which services. So it was an internal connection of those folks who didn't know that their resources were even existing in their organization. So that was one amazing experience. Use what I've learned from having led it with my memory cafes, because I'm constantly dealing with or working with caregivers. So it's been hugely helpful on that front. And also some of the stuff that I've learned, I've applied in my experience of being a caregiver for my 95-year-old dad who has dementia. And yeah, it's just an extra kind of tool in your tool belt. So I would encourage anyone who has the opportunity to take advantage of going online and doing it. And anyone who's interested in taking it on, reach out to Caregivers Alberta as well, who also can facilitate that, or myself directly. So happy to help anyone. But again, just thanks so much to you folks and your committee for making this a reality.
Thank you, Jennifer. Really appreciate your comments and encouragement. It brings me to my caregiving journey and how much this Caregiver Centered Care initiative has helped me with my caregiving role and stress and burnout. And I'm reminded of that every day when I talk about Caregiver Centered Care. Right after this meeting, I'm taking my mom to an appointment, which means interrupting the day, and it's not easy to, get mom into a car and then into a building and then wait and get the appointment and then back home. And these are they seem to be like simple things, but they can pile up, depending upon the needs of the care receiver. The other thing I want to say, Jennifer, absolutely. What we found is a huge percentage of our colleagues are double duty caregivers. So as they go through these modules, there is actual bonding that's happening amongst double duty caregivers, and the recognition that we need to support them within our own settings. People that are working with us need support.
Yeah, I think the video that you had shared too with Linda Powell and talking about that isolation and how difficult it can be to ask for help. And I think your point, Jasneet, about it's the caregivers that are those roles that are unseen. And I think, Cindy, you had made a comment in the chat box at one point around the unseen part of it. You know, how many of us are working with folks in that caregiver role and don't know it yet? It's a, yeah, great.
Defining
And thank
that,
you, Jennifer, for your examples as well.
yeah, and one of the examples that Jennifer gave is also a very important one, is that actually uncovering the resources that are available in your community. Once you start talking about caregiving, people will start to share what is available. So it's like asset mapping. So when you're doing this education, you know, and you're coming together as teams, as communities to receive it, you start looking at how do we support the caregivers? Because your mind will always go there once you recognize them and you look at their needs, you start thinking of, well, how am I going to support them? And that's when the resources emerge.
Yeah. I apologize if I missed. Oh, sorry, Helen.
I think Cindy's trying to jump in here. So
I just, I sit on the Caregiver Centered Care co-design team with these beautiful ladies, and I really have to commend not only their passion behind this, but these courses that they've created. The content is absolutely beautiful. They have done such a well job. And when you go through them, you really do see the value of caregiver-centered care in a whole new way. Like what Jasneet was saying, my father-in-law was just diagnosed with early onset Parkinson's. And so we're going down that path. And I don't know, it's just very validating to take these courses. Not only has it helped me, as a caregiver, but it also to work alongside caregivers and help get this word out there. There's so much value in it. And I strongly encourage everyone to take these courses. These ladies have done a beautiful job.
Yeah, thank you, Cindy. What is the time frame, just for those who haven't taken it and wondering how much time commitment it might take to go through the courses? Can you provide a sense of that?
The foundation education can take anywhere from 45 to 60 minutes. It depends how much time you spend on the interactive pieces. The COVID module, similarly, about 45 minutes. Again, they're all interactive sessions. The advanced care has 6 modules. Each one is about 45 to 60 minutes long. Again, there are interactive pieces to each one of them. It depends on how much time you want to spend on them. So, and the Caregiver Centered Care Champion Education is going to be a 3-hour module. So it's going to be 3 modules, 1 hour each, Sharon.
Great. Thank you, Jasneet.
And I would just add, just from the facilitation standpoint, from having facilitated it before, it was a 3-hour time commitment face-to-face. And that's because there's just so many golden opportunities to pull the information and have discussions, robust discussions, very interactive because of the components that are the video. But you can kind of go by the room. But what's worked for me is to set aside a 3-hour chunk of time to allow a lot of really rich discussion.
And yes, the timeframes I gave you, Sharon, was for asynchronous learning online. Absolutely. These modules are being used in a variety of ways. And the example you just heard is a very good one. So we have people taking a module and having a workshop in it, a full session on it, a facilitated one. We have organizations who've split the module, even the foundational module in 6 centers in Saskatchewan have split them into 10-minute bites to share with their staff and then have a conversation after taking the module. So the facilitated opportunities are massive, really. If you take any of this education and you can run them as lunch and learns, you can run, people can flipped classroom style. So we do this with our OT students and medical students. They actually go online and take the education, and then we spend time with them reviewing the information. That makes for much better sort of assimilation, of that information.
Yeah, I love the idea around the team building, and Jennifer, you shared that. It gives each other a common language, but then how do we connect these resources? So that's great. Just looking at the chat box, some comments here. Education is key, especially when it helps with cognitive health as a preventative measure. Yeah. And Sharon, thank you for your note there around the modules. Shauna, do you have a sense how many PCNs have done the training? Jennifer, I wonder if a few statements from you with a link to the training could be shared with all PCNs.
Yeah, absolutely. I would love to have conversations with all PCNs. I've had a quick chat with Rural Primary Care Network, but there's certainly many opportunities. So in terms of what who I've led to, I've only led to Calgary West Central, but many opportunities to connect for sure.
There's about 6 caregiver champions from different primary care networks. And I have to tell you that we have caregiver champions from the far north to the far south and east and west.
So Jennifer, we
great.
will definitely be getting in touch with you because we want to learn from you, because that's what we do. We learn from all our stakeholders, and then we continue to build this initiative. And absolutely, as Shauna said, we would like to see all the PCNs take on this initiative, because it's more than knowledge and skills. It's the approach, it's team building, it's asset mapping. So we'd like to reach out to you if that's okay, and learn more from you. And then Shauna, we can get back to you and share that information with you.
Great. Thank you.
And Bafa, thank you so much for your comment. I do want to say that caregiving actually affects the cognitive health of the caregivers. We saw that in our survey during the pandemic, and it happened. It was already happening before, and it's still happening. Caregiving, depending upon the length and load of caregiving, affects the cognitive health. They have caregivers report mental health deterioration, as well as developing mental illnesses such as depression and anxiety, stress, and burnout. So yes, it is something that we should be looking at to prevent. And I know how much my caregiving journey has helped my mental health. When I feel, and I feel very supported now with the colleagues that I work with. I identify myself as a caregiver, I express my needs, and I look for supports.
Great. Thank you, Jasneet. And Moo, I think your hand is up.
I was wondering if you thought it would be appropriate to be added into the if the local high schools were prepared to do it as part of their program for encouraging young people to go into being a PCN or an LPN. The courses I know in Northern Gateway have been dropped, and I am going to talk to the counsellor and then to the school board to try and get them reinstated, because we are very short of professional caregivers, and this is my way of trying to encourage them to restart the courses in high school so those kids can get part of their certification. Then they can get a $9,000 grant, then they can go to school, then they can earn money while they're trying to decide what to do at university. This is my goal. So my next goal. So what do you think? Do you think that that would be a good approach to use to the counsellors?
Absolutely, Mew. And what a lovely suggestion. And we haven't thought that far yet. Definitely, we are introducing this module into training, all the training institutions of all disciplines, right? So UFC, UFA, Bow Valley, Northwest, Grand McCune, they're all on board, and they're looking to see where they can incorporate it into the training of their trainees, right? So Northwest is another example.
Yes.
However, high schools, Mew, what our education does is give certificates. So you get certification, and that's from our, you will see the logo of University of Alberta, the Department of Family Medicine, Applied Health and Researches. It's actually going to get micro-credentialed by the University of Alberta very shortly. So every hour gives 1 hour certificate, and depending upon the institution, like CLPNA, OTs, medical, they get a certain credit for it. So what happens? And they can take that credit and apply it to their training program to fulfill requirements or for scholarship. So absolutely, and we'd love to work with you. We have lots of opportunities coming available in the next very soon. to advance this education. So please contact Glenda Ternowski. Glenda, if you could contact Mew, Sharon, I think you already know Mew. So if we could look at, is there a way high school students could take some of this education and we can adapt it for them, and they can get some credits and they can apply towards scholarship.
Yes, thank
Great
you.
idea, Mew.
That's extremely helpful. Now that we've got the invoicing program throughout the province, so push everybody onto that, please. Everyone there, if you're involved with it or not, tell your family, tell your caregivers there is the invoicing program available now. As of the 1st of January, it should be provincially. So that kind of accomplished that. So this is my next goal, to fulfill that accomplishment.
You know that
Thanks
it was
so much,
Dr.
Mew.
Parmar that piloted that program, that began that program in the Edmonton Zone Home Care.
No, I didn't. Well done. I had no idea. Well, perhaps you do have an idea because you're a very caring person. How much that means.
It was
Caregivers over the self-managed care, which was horrible, as you well know, my feelings on that.
We actually, it was the input of an advisory committee that included not just clients of home care, but caregivers of home care, that this suggestion came from, and then we found the means to put it into play. And Sharon actually did the research on it. And
yes, I know she did.
Yeah, and then gradually it rolled out. It is a beautiful and so helpful as a program. Thank you for advocating for it, Mew.
Yeah.
Oh,
Thanks so much.
I was just going to add
And
just one piece, Mew, that I've done some work in Okotoks high schools. They've been very receptive to doing a dementia simulation. The students are really on board with that. So I love this idea of going the next step and do caregiver-centered care within that environment. And I've also reached out to the Oilfields High School in Diamond Valley. So rural, I think, is sometimes an easier I find, in terms of the high schools. So we'll love to chat with you more about the possibilities on that front.
Absolutely. Yeah. Yes, I'm quite excited. You guys have really inspired me, I have to say.
Well, thank you for bringing your ideas, Mew, and being open to sharing your experience. Just looking at the time, thank you again, Jasneet and Sharon, for your presentation and your inspirational, infusing inspiration into the call this morning. We'll make a connection, Glenda, between Mew and yourself following the meeting today. You're okay with that, Mew?
Absolutely.
Okay, great. And I'll just share my screen here with a few resources, which will also come out with our recording. So just to touch on a couple of things. One, we had the opportunity. Oh, am
I'm not gonna.
Can you still hear me?
Yes, I can hear you, Sharon. Yeah, now it's
okay.
showing.
I keep getting these Zoom quit unexpectedly prompts. So, okay. So just a couple of resources. One, a couple of weeks ago, Alberta Health Services had the opportunity to host an event where Cormac Russell spoke. The event was called Beyond the Walls, partnering with people and communities to achieve health. So within the slide deck that will come out, there is a link to that. Also in the Cormac Russell world, he and Sasha DeWolf, who is Canadian, she's from the East Coast, have a podcast called The Connected Community. So if you're into podcasts, I think there's 3 or 4 episodes now of The Connected Community. So wherever you listen to your podcast, that's a great one if you're looking for inspiration and more information on supporting people in community and how to build community. The third resource just around how to be a dementia friend. So this is a Dementia Friendly Canada project led by the Alzheimer's Society. So another resource there. And then a Better Aging report, Courage Action for Better Aging. So just a few resources to whet the appetites of keen minds in the group. And as always, we'll refer people for more information on our work to our website. The QR code is on here, but as well the other information. Any questions around this work or for our team, certainly reach out to us. We have a generic email, but you can also email us individually as teammates, and any door is the right door to have questions answered. And of course, if you haven't joined our open group already on the Healthy Aging Core Alberta platform, there is that ability there as well. All right, I think I skipped right over the contacts. There it is there. And we're just at 10:30 now. So thank you all. Again, thank you to Jasneet and Sharon for your presentation, willingness to share your knowledge and enthusiasm. And thank you to those attendees for your questions and comments. It's always an hour that goes by incredibly fast. So we wish you well in the rest of your day, and thank you again for joining.